Hi, good day. I'm Dean van der Westhuizen. I'm an eye specialist working in Mbombela in South Africa. And today we're going to chat briefly about AMD, or age-related macular degeneration. This is a very common condition affecting mainly elderly Caucasian patients, and as the name suggests, it's age-related, so it's in elderly patients. It's the macula. Now, the macula is the central part of the retina. If you look at this image that I've got over here, you can see this portion over here, right in the center of your retina, is your macula. And so this part is the area that is affected by macular degeneration. And so it's age-related, it's macula in the center of the retina, and it's a disease that results in degeneration. And so that central area of the macula degenerates, and as that happens, the central vision becomes poorer and poorer. And so normally the peripheral vision is spared. You can see to the sides, but centrally, reading, driving, recognizing faces, those kind of functions deteriorate significantly and can be very debilitating. AMD essentially comes in two forms. There's a variety of ways of classifying it, but one of the most common ways that it's described as is either dry AMD or wet AMD. So dry AMD describes a condition where you get deposition of what we call drusen, these metabolic waste products that sit underneath the retina. If you look at the scan of the OCT, now this is a slice through the macula on an OCT scan, and you can see these little bumps over here are the areas of drusen. This is a normal part of the retina, and you can see as we get here these little lumps and bumps under the retina, and these are the defining features of dry AMD. These get bigger over time. They start small, they become intermediate and large, and then they coalesce to become large areas of dry AMD, and the retina above these areas starts to degenerate. Dry AMD is slowly progressive. It slowly gets worse and worse over time. It does vary between patients. In terms of intervention, there's not a lot that we can do for dry AMD. From a wet AMD perspective, why we call it wet is because there's fluid. Those deposits of drusen that are underneath the retina cause disruption of the blood vessel layer underneath there called the choroid. Blood vessels then grow up and start to leak under and into the retina. You can get fluid and blood in the retina, and that normally results in a sudden deterioration of vision. So unlike dry AMD, which is a slow decline, suddenly the vision deteriorates as you bleed or there's fluid that accumulates in the retina. These patients require intravitreal injections. You may have heard of patients getting injections into the eye. Very small volumes of what we call anti-VEGF agents are injected into the eye to get rid of that swelling and to settle that bleeding down. And often multiple injections are required to keep that under control. Often people ask me, which is better, dry or wet? It's a difficult question to answer. Both can be very debilitating. Dry AMD is slowly progressive, and there's no real treatment or intervention. Where wet AMD is much more aggressive, it causes the vision to drop quickly, but there is an intervention in the form of intravitreal injections that helps to settle it down. Now, the disease is normally on a spectrum. It starts mild, normally starts dry, and as time goes on, dry converts to wet. And that's what we're trying to prevent. The only real intervention that we know does help is a combination of vitamins called Ocuvite supplementation, which has a lot of robust evidence from the AREDS 1 and the AREDS 2 trials. And that showed that there was a decrease in the progression from dry AMD to wet AMD. So Ocuvite won't take your AMD away, it won't get rid of the drusen, but it helps to prevent dry AMD from converting into the wet form. It's really important if you are diagnosed with dry AMD to be on Ocuvite supplementation, but in addition to have regular checkups and also to keep a track of your vision at home. We normally use what we call an Amsler grid to help monitor that, which is a grid you look at to determine whether the lines are straight or whether there's any missing spaces, and that helps to determine whether there's any progression, because we're wanting to pick up wet AMD as early as possible if you convert from dry to wet. So monitoring at home with an Amsler grid, taking Ocuvite and having regular checkups is important if you are diagnosed with AMD. But that's AMD in a nutshell. I hope it was interesting, and thanks for watching.